Have you got a really dull pain at the back of your heel? Maybe you were running and you woke up the next morning and you felt this pain, or maybe you were playing basketball or football or soccer, depending on what you call it, and you woke up the following morning and your calf was feeling really tight and there was just a sort of dull pain in the back of your heel. Or maybe somebody noticed that the back of your heel looked kind of swollen or something like that. If any of this is sounding familiar, then you most likely have either suffered or are suffering from Achilles tendinopathy, basically pain in your heel. And in today's video, we are going to talk about this. Hello everyone, my name is Paul the Physio. Welcome back to my summer kitchen. And today we are talking about Achilles tendinopathy. So we're going to break the video down as follows. I'm going to explain why this injury happens, and then we're going to talk about what are the most effective treatment methods according to the literature. And then I'm going to share with you my top tips for recovering from this type of injury and even preventing this type of injury in the future. So this is going to be really helpful if you are a long-term sufferer of this type of pain in the back of your heel, or even if you're a therapist or a doctor and you regularly see patients with this type of pain. I'm going to share with you my top tips and simple exercise program that will get you back to where you need to be. Achilles tendinopathy. What is this injury and why does it happen? So Achilles tendinopathy, Achilles is that big thick structure that sits at the base of your heel and comes up into your calf muscle. You can see here. And then tendinopathy. So tendon is what this type of structure is. It's the Achilles tendon. And then opathy indicates pain, dysfunction. Sometimes you hear itis, which more indicates inflammation. But basically, it just means pain and dysfunction and limited use of your Achilles tendon. What does it do? As you see here, it extends from your calf muscle and goes into your heel. So it essentially helps with the movement of your foot and ankle. It is the biggest tendon in the body. And what we're going to do now is explain a little bit about what a tendon is and why it gets pain and how that's different from a muscle, because that is very, very important to understand when we are rehabbing and when we are recovering and trying to understand this type of injury. So tendons connect muscle to bone. I like to think of them as energy transmitters almost. So your muscles are generating the force, the activity, and the tendon is what transmits that movement and then makes it act on the joint so that it moves. In the case of your calf and then your Achilles tendon, it's going to lift up your heel, help bring your heel down, lift your toes up, lift your toes down, as in the ankle moving up and down like so. Okay? So it basically is the transmitter of that energy onto the joint that it is acting on. And it is slightly different from muscle. It is a more dense connective tissue. It's made of essentially just tendon cells, water, and collagen. And under the microscope, it just looks like lots of individual fibers really closely packed together, exactly like you're seeing here with this spaghetti. Like this is exactly what it looks like under the microscope. If you Google images of it right now, tendon tissue, this is what it will show you. And it's just lots of individual fibers like so, and it's connecting muscle to bone just like that. And you can already kind of see how this area can get affected sometimes, just because if you look at that and now I try and move this pasta up and down, it does seem quite fragile. We all know that if I snap it, I can. But for any Italians watching, I'm not going to do that. I know that is blasphemy because I want to use this later. And like I mentioned, their role is really just to take that energy and that force that the muscle generates and transmit it to the joint to move the bones and everything after that. So you have the muscle force, tendon, and then the body part will move thereafter. That is kind of a simplified version of how the process works. And depending on the activities you're doing, that force can be transmitted very quickly, very abruptly, or even very suddenly. And with the Achilles tendon, that is really, really popular because what we see a lot is the common injuries come from people who do running, sprinting, jumping, change of direction. These are kind of the main things. So whether you're a recreational runner or you play any kind of sport, football, American football, basketball is a really common one. Anything that has a lot of jumping and landing and turning, these often put a lot of force and pressure through that Achilles tendon, and it can happen very suddenly. And this injury is characterized as an overuse injury, just basically exceeding the capacity that the tendon can handle, which causes it to get damaged. And this can just be in the idea of pain, and this can also come from inflammation as well. Sometimes you often see that people's tendons get really, really thick and swollen. Other times they just have a really, really dull, achy, strong pain. The other thing that's really correlated with the injury is having a really tight calf muscle. So often you'll find that people's muscles are not that relaxed, they're quite tense, they're quite tight, probably because they've been doing a lot of the exercises and the activity. So you're running a lot or you're playing a lot of sport, but you're not really backing that up with appropriate rest and recovery and even appropriate strength and conditioning. So the muscle isn't quite lengthening enough and isn't quite relaxing. And over time, it can just get a little bit stiffer and stiffer. And then if you plant the foot or you turn direction too much, then that can basically cause that increase in pain. So yeah, we class it as overuse, which is something we talk about a lot on this channel. And it's basically just that idea that you have exceeded the amount of force that the area could handle. You have done too much too soon. Just think of it like this. Anytime you've had to work extra long hours or consistent overtime, or maybe you're studying at university and you just don't stop. You just keep on studying, going to classes, going to work, staying in late, working at the weekends. Eventually a lot of us just get to one of those burning points and bursting points where maybe we express a lot of anger, express a lot of emotion, or even relief when we get over that finish line. And that just burst of, it's very similar to that, but it's just a case of it's your ankle tendon that's experiencing that. And yeah, if you keep on pushing it and keep on pushing it, what it's going to do is it's going to react, and it's going to react with that and that pain. And yes, the pain is usually quite kind of dull and achy, and you can really, really feel it right there. You're either going to feel it right in at where the tendon meets your heel, or you're going to feel it a bit higher up and more of the belly of the tendon as it goes into your calf muscle. This is the biggest tendon we have in the human body, so there are lots of pain sites you can have, but usually you can see some swelling and stuff like that. We diagnose it with really just understanding the history of what happened, a few clinical tests like seeing if you can do some heel raises, that's an easy one, and then just generally feeling around the area, because if we can touch it, palpate it, and it's really sore, that's a pretty good indication that you have Achilles tendon pain. The other thing that you can always do is get an ultrasound image just to clarify and have a look more at sort of internal structures of the tendon and get a better idea. But that is the main thing there. It's a really common injury, and you'll see that recovery times will vary, obviously, depending on how severe the injury is. But you're looking at anything from 3 months to 12 months if it's just the first time or the second time. Some people have this condition chronically, meaning that it just kind of flares up and flares down over their life. And you can be experiencing that for 10 plus years, so it can go away, come back, or you can always have a sort of dull tightness there. And obviously, we're not talking about tendon rupture. That's completely different. That's more when there's a sudden impact injury and something has happened there. What we're talking about here is when the tendon is just overused, tired, angry, wants to take a rest. Treatment for the injury is fairly straightforward, and we are going to go over that now. But before we do, I just want to ask everyone, if you're enjoying the content, please hit the like button, subscribe to my channel, and let me know in the comments below if you have Achilles tendinopathy and how is it going? How is your recovery going? Do you still experience this type of pain? What kind of information are you looking for? Thank you so much for joining me and watching my videos. It really means a lot. and I'm making all these videos for you guys. I want to help you understand your body more. I want to help you understand what therapists and doctors are actually thinking so that you can get in their way a bit more and basically start to help yourself a little bit, because the power of knowledge and understanding here is instrumental. If you can understand what you're up against, it's so much easier to handle it. So yes, I just hope that this helps you understand this injury more, and then we'll help you recover over the coming weeks. So now that we've done that, we're going to talk about the treatment options that you can go for. So it's very, very straightforward. You have non-operative and operative, basically surgery versus not surgery, or sometimes you hear non-conservative and conservative. But it's basically, are you going to get a surgery or are you going to not? That's it. Those are your two options. And when it comes to the surgery option, there is still a lot of evidence that it can be helpful, particularly a gastrocnemic release surgery, which is kind of alludes to what we were talking about earlier when I said that most of the time the calf muscle is really, really tight. And one of the ways that you can actually test if your calf muscle is tight and if you're potentially either going to get tendon pain in the future or have it is by having your foot stretched out like this. You can see the video here. And then seeing how much you can push your ankle up, bringing your toes and ankle up as high as you can and feeling the limitation of the ankle joint. And then what you do is you bend the knee, and then if you can feel that there's a lot more movement there towards your shin bone, then that is a sign that your calf muscle is extremely tight, because when we bend the knee, we relax that calf muscle, that one in particular, the gastrocnemius, that is relaxed when the knee is bent. So that's a good sign that your calf muscle is extremely tight and that you either have tendon pain or are going to have it. So the idea with the release surgery is that they just have a look internally. I'm not an expert on the subject, but they have a look at the muscle itself and the operating table and just see how much of it is extremely tight, how much of those fibers are contracted almost, and then they just simply release them. That's it. Now, it's shown to be pretty effective in reducing the pain. That's the main thing it does, and function, and just overall feeling and happiness. People feel like their ankle moves more, they have more freedom, they can walk better, they feel less pain. The thing that's interesting though is that you often see a massive dip in strength in the muscle region. Of course, you've just kind of taken away some of the muscle fibers, and most likely the ones that have been working the most, if they're the ones that are very contracted. But that doesn't seem to affect anyone. It doesn't affect your function. So yes, it's still a recommended treatment option. But the general consensus within the orthopedic and surgeon community and therapist community is simple. Always try conservative treatment first, or physiotherapy treatment first, or however you want to call it. And then if you feel like you're not getting anywhere, that's when surgery is there as a good backup option. Why? Because the other non-conservative options are just as effective, if not more in some cases. And we've spoken about this before. Costs are such a huge thing in healthcare. Doesn't matter if you have private health insurance or not, it's still a massive cost to go under the surgical table, as opposed to maybe just getting a few sessions and having a training regime. It's much more cost effective, and the differences in results aren't enough to say that you should always get surgery. So then let's talk about those non-conservative options. The first thing that we learn from the literature, especially over the last 5 years, is do not just wait and see. So sometimes with injuries and pain, it is really powerful to just let it be, rest, and just pure rest and recovery. It's a really underrated treatment. A lot of the times we're just always so quick to recommend something, tell people to do something. But sometimes if you do just take it easy, avoid the painful factors, it will kind of heal itself. Tendon pain is somewhat different, and specifically Achilles tendon pain is different. That this region of the body doesn't have a lot of blood flow, and the Achilles tendon itself has very, very little blood flow. It gets swollen quite easily, but there's a lack of anti-inflammatory sort of response in that region as well. So the swelling is more likely to stick around long term if you don't take the right actions to reduce it. Whereas if your fingers get swollen, or maybe another part of your body gets swollen, there's a lot more, the body is more capable and available to use its own anti-inflammatory cells and reduce that itself. But the Achilles tendon is a place where there's just not as much of that going on. So it's got reduced blood flow and reduced ability to recruit anti-inflammatory cells compared to other areas and other tendons. So that means that its ability to heal itself is a lot lower than other areas. So that's why I think the general consensus is do not wait and see with this one. Get it seen, get it checked, and do start a recovery program, start an exercise program basically with your therapist, with your doctors, and whoever you see. And then if you get 6 months down the line and it's not working, then that's when you would maybe have a chat about getting that gastrocnemic release surgery. So then let's look at the exercise options then. So there's really two ways of doing this. You either want to do an eccentric loading program or a heavy strength resistance, a heavy slow resistance program. These are the two kind of types that they talk about in the literature a lot. I think you're better just doing a mix and match and seeing what's comfortable for you, and most importantly, seeing what's relevant for you, depending on your goals as a patient. But we'll talk through these ideas right now. And the reason that strength and muscle movement and activation is the best treatment option is that that's where the injury came from. The injury came from the muscle and the tendon not being able to withstand the forces and pressures that you were putting them under. So in order to rehabilitate them to that level and an even higher level, you have to build up the strength and the mobility. And there's a lot of theories around doing eccentric movement. So the eccentric movement is when the muscle is relaxing. So for the Achilles tendon and for the Achilles tendon and your heel muscle, your gastrocnemius, your calf muscle, it's the coming down. So basically this is you using your calf muscle, and this down is the eccentric part. So when your heel is coming down to the floor. So basically what you do is you go fast up to here, and then you come down nice and slowly. And you do this as a strengthening program. And this is considered, and the theory is very simple because, like we said, the calf muscle is often very tight, the tendon is often very tight. So by focusing on eccentric movements, you're focusing on lengthening that. So you come up into the position, but you don't stay there for very long. You don't hold that position for very long. And you focus on coming down slowly and on that eccentric movement, which in theory is going to lengthen those calf muscles and lengthen the tendon and stretch out. And the idea is that repeated movement is going to promote healing as well. That's another thing that we theorize from the literature. Again, haven't quite confirmed this, but there are some ideas that it actually promotes healing of the area, helps to reduce the inflammation, as well as gradually build up the strength. So what's always effective is a 12-week training program where you do these eccentric exercises and they get gradually more difficult. So more weight, doing it more, increasing the intensity, frequency, and repetitions over time to get you there. And after around 12 weeks, you'll see a reduction in pain, and you will see an improvement in quality of life and returning back to hobbies and sports and activities gradually. And then the other option that you see is heavy slow resistance training, which is basically the opposite. So now you're focusing on using that muscle and doing it nice and slowly, even probably holding it a little bit and coming back down. So your focus now is on the muscle contraction part and the eccentric part. So you're focusing on the whole movement. Whereas on the other one, you're focusing just on the eccentric movement, and you usually use lighter weights. Whereas the idea here is you just do classic resistance training with the idea of promoting strength, like we've spoken about on this channel before. Get the muscles stronger and promote the healing that way. And when we perform exercise, it releases opioids in the brain and stuff, and usually can help us to reduce pain. That's the other idea by doing this, is that that's how we can sometimes feel less. But that's not always the case, and a lot of people will push into pain and actually experience a lot of pain when they are exercising. So there is usually a good period of rest and recovery when this injury really kind of flares up initially, of maybe just a week or two, and then a gradual program of easing it back in. And yeah, for me, the best way is to talk one-to-one with someone and figure out exactly what their goals are, and then design a program that's going to help them get back there the quickest. So yeah, I like to do a mix and match, and I like to break this injury down in terms of the functional activities. So I found this information a few years ago where someone basically broke all the exercise movements down and put them into 3 categories. And I think this is the best way to approach it, and we're going to go through that right now. So there's 3 categories. There is a load that is lower than walking, a load comparable to walking, and a load comparable to running, because these are the main activities that we need to be doing here, walking and running. So the first set of exercises are for people who are very new to the injury and are struggling to walk. So then these exercises are of a lower load than walking. So they shouldn't cause them too much pain. And once they're comfortable at doing a handful of them, then you know that it is time to move on to the next set of exercises, which are of a comparable load to walking. And then once that you're comfortable at those exercises where it's a comparable load to walking, then you know that you can start increasing your walking more, and walking is going to become comfortable. So you do these things in tandem. So when you're doing the exercises that are of a lower load to walking, you're still walking around, but you're maybe not going for long walks for a certain distance or a certain time. And then once you're moved on to the second set of exercises that are of a comparable load to walking, you're going to combine that with an increase in walking distance. And these things are going to work in tandem. So it's going to be a very, very specific, goal-focused rehab program. You're going to be able to see these exercises are similar to walking. I'm walking a lot more. I can feel how that works together. And then the third set of exercises are ones that are comparable load to running. And then this is the great thing about this method, is because see, if you don't run, then you don't necessarily need to move on to the third stage. Obviously, it is advised, and as physical therapists, physiotherapists, is literally, it's our job to promote health and physical activity. And we're always going to say, we can keep progressing the rehab. Here's how you can continue to progress it at home. But if you don't want to, you don't have to. So it's really helpful for therapists and also for patients, because you can see where the rehab's going to stop. But yeah, let's say you were running before the injury happens, then you now have a list of exercises that are of a comparable load and stress to running. So once you know that you're comfortable doing a handful of those exercises, then you know that the running is going to get easier. So once you get to that third stage, you start doing a little bit of running, maybe half a kilometer at a time, increase it to 2, doing some exercises. And then once those exercises are really easy, you see how you can just start to increase the running distance gradually over time. And you could easily do this over a 12-week period, 6-month period, and you would be back to where you are in no time. Obviously, the next stage is returning to sport, so making it very sport specific, if it's like basketball or football. So there's lots of twisting, there's lots of jumping and planting. Now, there are lots of jumping exercises in here as well, but it's just a case of progressing it that step further if that's what you need. But I think this is a great resource, and what we're going to do now is we're going to go through some of the exercises in here, and this is a great place to start. If you're a therapist or a doctor, you can use these exercises as almost your battery of tests, because sometimes all we want to do is just test functionality, see where our patients are at, see how you're progressing, and these exercises are comparable load to that of lower than walking, running. So it helps us understand the functionality. So it's really straightforward. I would suggest minimum pick 2 exercises at a time and really, really do them to the point that they cause no pain, and then go to the next stage, and so on and so on. And while you're doing that, gradually increase. So starting off, you're not really walking around much at all, only when you need to, short distances in and around the house and to the shops, the essentials. And then once you're comfortable with a handful of the first set of exercises, then we're going to start adding walking as a part of your rehab plan. You're going to go out for a half a kilometer walk doing some of these exercises. Then a couple of weeks later, we're going to make it 2K, and so on. And then once you're up to maybe like being able to handle a 5K walk plus pretty much all of the exercises on that list, then we know that the tendon can handle walking and exercises similar to walking. So then we have to make a decision. Do we want to include the running? Do we want to progress? And then we go to that. So then with the running, it's the same idea. Start at small distances, Most of the time what you do is you go half a kilometer run, walk for a kilometer, half a kilometer run, walk for a kilometer, and then increase that and start to just do more and more and more. You'll only run once or twice a week. And then again, once you're maybe up to that 5K mark, and those exercises are causing you no pain or discomfort and you feel a lot stronger and more mobile, that's usually a good sign that the tendon is pretty happy. Obviously, if you're a marathon runner, 5K is not going to be a lot and you're going to have to keep working up the distance. And again, that's just going to be a case of figuring this out. The reason this video is very valuable, though, I think, is for that reason, because what often happens with your orthopedic specialist or your physiotherapist or your physical therapist or even your local doctor is it'll come to a point where they have to discharge you. You are probably not 100% healed, but they have other patients, they have other priorities, they have big lists, and you're at a point now where you're pretty much back to where you were, and the pain is not stopping you in life anymore. You might not be back to the same athletic level you were before, but it's not getting in the way. So what often happens is you're discharged with a plan. But those plans might not be specific enough, they might not be tailored enough, and they might not be clear enough. And that's where this video comes in, because you can see where maybe things got lost in translation and where you need to pick up on. So you've got this list of exercises here that you can just look at and think about. And there's a lot of exercises there, and I'm just going to quickly go through them all in a quick montage so that you can get a good idea of which ones to do.
À vouloir tout fuir et on reprend comment c'est laissé nouvelle histoire, cette folle épopée, les souvenirs fusent de tout part, si heureuse enfin te revoir, pourtant c'est un tumulte qui sévit à chaque fois qu'on se retrouve sous les feux de la nuit. Savoir que l'amour qui nous lie devient plus grand et fort que tout ce qui nous différencie. My favorite hello again. How you been keeping our friends?
How you doing, young lady? The feeling that you're giving really drives me crazy. You don't have a player like the coach. I was at a loss for words first time that we spoke.
You're looking for a girl that'll treat you right. You're looking for in the daytime with the light.
You might be the type to play my card right. I'll find out by the end of the night.
You expect me to just let you hit it, but will you still respect me if you get it?
All I can do is try, give me one chance. I don't see the ring on your hand. I'll be the first to admit. I'm curious about you. You seem so innocent.
You wanna get in my world, get lost in it, but I'm tired of running. Let's walk for a minute.
Wherever you are, I'm all alone, and it's you that I want.
Mr. You already know that I'm not.
And that is the Achilles tendinopathy. That is why it happens. That is what treatment options are there, and that is what exercises and movements and regimes are going to help you recover from this pain and help prevent it in the future. I hope you found this video helpful, and if you suffer from this type of pain, please let me know in the comments below what exercises you're maybe going to try or what things you learned. And if you know someone who has Achilles tendon, or they say their heel is really sore, or they say they can't really jump anymore, send them this video. It might really, really help them. Thank you so much, guys, and I will see you all in the next video.